So if you think erectile dysfunction is just about sex, you're missing the bigger picture. This is Dr. Shirley Veronica Choka, and this is your Ultimate Uro Guide. Today we are delving into erectile dysfunction. It's quite the silent pandemic that affecting quite a number of people, with a prevalence of over 50% among individuals between the ages of 40 and above. So you can imagine how prevalent it is. And many people encounter it, and there's a lot of stigma and shame around the conversation, but I think it's something that needs to be addressed and talked about and covered. So what is erectile dysfunction? Erectile dysfunction basically means the inability of an individual to get an erection strong enough, sufficient enough for sex, essentially. So why do I say there's a bigger picture to it? This is what most people don't know, is that ED can be a sign of an underlying problem. This could be diabetes, hypertension, mental health issues, or even heart disease. When you come to a doctor, what are the questions? What are we looking for? Essentially, the first thing a doctor would ask you is whether it was of gradual onset. Is it something that has been progressively getting worse over time, or is it something that happened once? The other thing we want to find out is whether you have any underlying conditions, because this could essentially influence how the disease presents in an individual. Then we want to know whether it's situational, whether it is throughout with the same partner, or when you're at home it's different, when you're outside. Those are the questions we want to find out. So what will be the tests that a doctor would send for? Because you'd imagine ED, you give medications and everything is done, but you have to do investigations that would be able to guide us better in the management of a patient. Because if ED is a presentation of something that is systemic, we have to treat the underlying issue before we can give supportive medication to treat the erectile dysfunction. So what are the things we'll look for? First of all, we're looking for how your vessels are working, whether you are cholesterol. So cholesterol levels are good, so there we look at the lipid profile. We'll also look at what we call the HbA1c. HbA1c is a marker in blood that shows us how your blood sugars have been regulated for a duration of up to 6 months. Then the other thing we'll look at is your hormone levels, because your hormone levels really affect your libido, your arousal levels and all that. So for men, most of the time we'll send for your testosterone levels and the other supporting hormones, the LH, FSH, and prolactin, to know whether there's a problem that could be affecting your sexual function. Then after you've been sent for all this, we analyze, and if there's an underlying problem, key is first of all to make sure we treat the underlying problem before we institute any kind of medication. So you've discovered you have ED. The underlying situation or condition has been sorted. Where do we go in terms of management? Number one, there's medical management of the same, which is usually the first line. There are medications that the doctor would put you on. I know most people have heard about the blue pills and the hazard around it. So that is number one. Number two, if that fails, there are what we call intracavernosal injections. This is where you aid the patient by injecting agents within the penile shaft itself to enable them to have an erection. And if that fails, there's the third line and the fourth line, where we employ the use of prosthesis. This is you add like prosthesis, you put in an implant into the penile shaft to enable a man have an erection that will enable them for sexual penetration. But these are usually like in the extreme of cases where everything has been tried and there's no remedy for it, or there's extreme fibrosis in the penis that it won't be. There's no other way, like the medication and the intracavernosal injections don't work. And I know we've talked about the organic issues, what your body does, the blood vessels, the hormones, the nerves, but there's a very huge conversation around erectile dysfunction, and that's mental health. When you classify erectile dysfunction, okay, when you're looking at causes of erectile dysfunction, there are two main prongs we look at. Either it's psychological or organic. Organic, this is where we're talking about your blood vessels, your nerves, your hormonal levels and all that, and the physical presentation of the penile shaft, whether there are any abnormalities. And the other prong, and which is very, very strong, is that your psychological health really affects your sexual function. And there's this saying that goes, good health leads to good sex, and good sex leads to good health. So your psychological health is key the psychological health is key in determining the sexual function. So if you have stress or any issues of mental health, they affect sexual function. And even some medications that people are put on for different issues of sexual health could also affect sexual function. So when all is said and done, at the end of the day, I think it's a conversation we should have with your doctor, so that you're able to pick these issues early enough, so that you can also mitigate the underlying conditions that would come with it. This has been Dr. Shirley Veronica Choka, and this is your ultimate guide.